Hello everyone and welcome to Know Your Drug, powered by MediInsights. The ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on sildenafil tablets, exploring the various aspects of sildenafil, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of sildenafil tablets. Sildenafil tablets are primarily used to treat erectile dysfunction in men, helping to achieve and maintain an erection by increasing blood flow to the penis. It is also used to treat pulmonary arterial hypertension by relaxing blood vessels in the lungs, improving blood flow and reducing blood pressure. Next, dosage of sildenafil tablets. For ED, the typical starting dose is 50 mg taken approximately 1 hour before sexual activity. Based on efficacy and tolerability, the dose may be adjusted to a maximum of 100 mg or reduced to 25 mg. It should not be taken more than once a day. For PAH, the standard dose is 20 mg taken 3 times a day. Next, mechanism of action of sildenafil tablets. Sildenafil works by inhibiting phosphodiesterase type 5, an enzyme that degrades cGMP. By blocking PDE5, sildenafil increases the levels of cGMP, leading to smooth muscle relaxation and vasodilation, which enhances blood flow to the penis and reduces pulmonary arterial pressure. Next, side effects of sildenafil tablets. Common side effects include headaches, flushing, indigestion, nasal congestion, dizziness, and visual disturbances. Rare but serious side effects include priapism, sudden hearing loss, and myocardial infarction. Next, important advice for using sildenafil tablets. Sildenafil should be taken as prescribed by a healthcare provider. Avoid consuming it with high-fat meals as it may reduce effectiveness. Do not combine sildenafil with nitrates or other medications for chest pain, as this can lead to a dangerous drop in blood pressure. Always inform your doctor of your complete medical history before starting sildenafil. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using sildenafil tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.